Greetings, everyone. Today, I want to welcome Kim Filkins to the show. Kim is the owner of the Three Moons Acupuncture in Kenosha. And we're going to get started today by having Kim share a little bit about herself. Kim, can you go ahead and share a bit about your story? How did you choose acupuncture as a career path?
Yeah, so I was actually a licensed veterinary technician in Los Angeles and had been doing that for about 15 years. Already had my bachelor's degree and absolutely loved it, but I was just getting burnt out. I was working graveyards and emergency is just crazy busy. So I started drifting from it and I'm like, okay, what else can I do? And at the same time, I was also studying Wing Chun Kung Fu. So I had been learning Eastern philosophy. And one thing just kind of led to another. I started looking at what I could do with my bachelor's degree and stumbled upon acupuncture. And of course, in Los Angeles, there's multiple schools. And I went and checked a couple of them out, found one that I felt comfortable with, applied, and the rest is sort of history.
That's great. That's great. So can you describe, and with your expertise, can you describe exactly what acupuncture is? Because I feel like some people have heard of it, but they don't know exactly what it is. And, how does it influence the body? How does the needles and the acupuncture points, how do they integrate and how do they influence the body with healing?
Yeah, so acupuncture is actually part of a larger medical system known as either traditional Chinese medicine or East Asian medicine. And estimates are about 3,000 to 5,000 years old. On average, we estimate that it's about 3,000, and it includes everything from acupuncture to herbal formulas, things like cupping and gua sha, which are accessory modalities that we might use. But as far as how it works, we actually use these hair fine needles, and they are placed on acupressure points. There's over 400 plus on the body and another 100 plus in the ears alone. And then that's just one system. There are multiple systems and each system has its own set of points. But we use these tiny hair fine needles that are solid stainless steel. There's nothing in them or on them. And the needles are placed at these acupressure points. And what happens is these acupressure points have an abundance of nerve endings, capillaries, and elevated levels of gasotransmitters like nitric oxide. So when we stimulate the acupuncture points, we are actually increasing nitric oxide mediated vasodilation. So basically what's happening is we're increasing blood flow, we are lowering blood pressure, and we're also decreasing pain. And gasotransmitters actually regulate many cell functions within the body, especially inflammation, which is a huge problem for most people. 99% of the population has underlying inflammation that they aren't even aware of. And this is one of the ways that acupuncture helps. Gasotransmitters are huge right now. Everybody's studying them, and it's extremely important. Again, the role that they play in dealing with inflammation and helping the cells in the body. So that's the main things that we do. Acupuncture increases vasodilation, increasing blood flow, decreasing pain, and lowering blood pressure.
And a lot of people, so when you say it lowers blood pressure, if somebody has high blood pressure, is acupuncture something that can help with that?
Absolutely.
Okay,
yeah,
so if they're taking medication, first of all, I'm sure neither one of us would say stop your medication, but work with your physician on that. But acupuncture could be part of a treatment plan, is what I'm thinking, to help somebody with blood pressure. Where I might come from an exercise standpoint, to use exercise. If the person is overweight, I might, work on weight management with exercise, but you could come along and collaborate with those efforts, and then in turn somebody might be able to get off of medication or decrease. That would be up to the physician to talk with that.
And the combination of things, I recommend exercise for patients as well. Acupuncture is, again, part of this traditional Chinese medical system. we treat the body holistically. So we're not just looking and compartmentalizing one area of your body. Oh, you've got high blood pressure. Well, that's all we're going to focus on. We look at everything. So yeah, if my patient needs to get off their duff and exercise a little bit more, I'm going to let them know. It's not slapping you on the wrist. It's the reality of it. We get lazy. We get complacent. We sit at our desks all day and we don't get up and move around. And it's extremely important. We got to get that blood pumping, not just when we have high blood pressure, but for everybody. So,
right.
And it also helps with elevated cortisol levels, which most of us also have because we don't deal with our stress. So all these things combined make us sick, and we don't realize it until we're in the hospital or until we need medication, or all of a sudden our pants don't fit and we don't know why.
So with the increased blood flow, I'm just going to elaborate on that a little bit. When I help people increase blood flow through some of the soft tissue or the hands-on treatment that I do, and I'm increasing blood flow, it's like a natural warming to that tissue. Do you see a lot of muscle relaxation with
Absolutely.
that as well?
Yeah, without a doubt. And there's a lot of, I guess, what's the word I'm looking for? There's a lot of debate right now over acupuncture versus dry needling. And dry needling basically stimulates those muscles, triggers them to release and go back to their normal state. We do the exact same thing. The difference is most people who do dry needling have very little training, whereas we have 4 years at least of schooling. So it's not that dry needling is bad. It's not, but you have to know exactly what you're going for. And again, when we're treating the body holistically, not only can I relieve those tense muscles by inserting the needle, but I can also lower your cortisol levels, lower your blood pressure, help you sleep better, improve your digestion. You're not going to get that from somebody who does dry needling.
Right. Yeah. And I don't know how to do dry needling. I know other physical therapists do that. But I have so many other specialties that I'm just in my own zone, basically. And I can appreciate the experience of somebody who's doing acupuncture. And for someone who's doing dry needling, I don't know if that's a weekend or if that's a few months. I don't actually know the background. So anybody who's listening here, that would be something that you would want to research on your own. Is this somebody who's been doing this for a while, or is this somebody who is, new to it? So I tend to lean on experience and expertise, but at the same token, everybody has to get a start somewhere.
Sure. Yeah.
Can you walk us through then kind of a typical acupuncture treatment that you might, what that session might look like?
Yeah. So for me, every acupuncturist is different, but for me, you're going to come in the first time. We're going to sit down. You got some paperwork to complete. We'll go through all your medical history. We'll do some question and answers, sort of going over and clarifying things. From there, there are 2 diagnostic tools that we use in Chinese medicine. The first is checking pulses on both wrists, and the second is looking at your tongue. And I actually take photos of the tongue because then I can go back and reference it and go, oh yeah, what about this? We need to address this kind of thing. There's a lot that can be told and sort of discovered by looking at the tongue and comparing it with the pulses. And the 2 sort of back each other up. So for instance, when we look at the tongue, one of the things that we're looking for is the color. Is it a nice pretty pink, or is it sort of bluish gray? Is it purplish? Is it bright red? All of those things give us indications as to what's going on internally. And we back that up by checking the pulses. The 2 go hand in hand. You can't have one without the other. And then from there, once I've developed the diagnosis based on tongue, pulse, and symptomology, then the patient gets their first treatment. That entails me placing needles at various points, and basically they're in a nice quiet room with some music going, lights are low, and a nice heated table, and they get to relax for about 30 minutes.
That does sound relaxing.
Yeah.
So that's interesting about the tongue color. I would never have thought about that. And it makes me wonder, because I work a lot with the TMJ, or the temporomandibular joint. and people with some jaw issues and headaches and migraines. I wonder how much, there's a lot of muscle tension associated with the neck with those things, as well as the face. I've never paid attention to tongue color, but I wonder like if dentists pay attention to that, or if oral surgeons pay attention to that. Is that something that's fairly unique to acupuncture?
It's definitely unique to traditional Chinese medicine. More and more physicians, whether it be dentists or doctors or whomever, are starting to realize that they can learn more just by looking at the body. So it's very, very, very slowly coming around that they're sort of picking up on some of the things that we've been doing for thousands of years. So yeah, it's at the moment it is pretty unique to traditional Chinese medicine.
I'm going to have to be paying attention to that now. I'm going to have to investigate that. So for some people, when they think of needles, they think immediately, oh, that's going to be painful. How are you relieving pain when you're sticking a needle in me? Can you address that? Because that could be a fear or a barrier that might prevent someone from trying acupuncture and missing out on the benefits of it.
So one of the things, I do offer laser acupuncture for people who are just completely needle phobic and there's no way I'm getting near them. So there's no pain associated whatsoever. But I don't know if you'll be able to see this. Where is my camera at?
Oh, yeah.
That's how thin these little guys are. And that's a close-up, so it looks huge. But you can see it's very, very tiny. And it's very, very flexible. You're not going to get that with a regular needle. When you go to get a shot or have blood taken, it's a thick gauge needle. It's got a hole in it, a bore, and all of those things can cause it to be more painful if the person doesn't know what they're doing or they're new at it. These guys, what you're going to feel is a quick little pinch. So as far as helping patients that are nervous, usually I will do a very mild treatment to begin with, about 10 needles or less. And I don't use a lot of hypersensitive points. The less flesh there is in an area, the more sensitive the point's going to be. So for instance, a point right here on the hand is going to be a little more tender. A point on the elbow, though, because we got a little more meat there, you're not going to feel it as much. So every point has its own set of properties, and they can all be used in multiple ways. And that's the great thing about this medicine is, again, we have 400 plus points to choose from just on the body. So I could have 5 different points that have the same properties. They decrease pain. So depending on where it's at, I would choose one over the other based on the patient.
I love that, because what one person may not tolerate, another person will, and you can customize the treatment, have a wide variety with 400 options, it sounds like.
Yeah, and that's the reason why conventional medicine doesn't like us, because we don't fit into their box, so to speak. You can't use the same protocol on every single patient because we've got all these different options, whereas with conventional medicine, well, you have to follow steps. If you've got acid reflux, well, you take this medication. If that one doesn't work, then you take this. If that doesn't work, well, we don't know what we can do for you. So yeah, it's much more customizable, and that's the greatness of this medicine.
With your knowledge in acupuncture, why would you recommend it over, medication or some of the other treatments out there that are available? Why would somebody want to choose acupuncture instead?
Well, first and foremost, let me say I am definitely not against Western medicine. I think it definitely has its place, and there are things that I'm absolutely going to say, you need to go see a doctor about this. But that being said, again, when you do see a conventional doctor, they're generally compartmentalizing things. So they only look at one aspect of what's going on. They don't look at you holistically. They don't treat you holistically, most doctors. So again, that's sort of the beauty of this medicine. And why I prefer it over conventional medicine is we're going to look at everything. Is it going to take a little bit longer? Probably. You know why? Because it took you 30 years to get in this position. I can't just fling a couple of needles and all of a sudden everything's gone and back to normal and you've lost 50 pounds. It doesn't work that way. But yeah, I love this medicine because of the holistic approach. We treat everything, and we may have to do things in steps based on how severe all of your conditions are. but eventually we'll get you where you need to be. It's just a matter of how much are you willing to commit to doing the work, because it's not just me flinging needles. You're probably going to need to take some herbs. You're probably going to need to adjust your diet somewhere. You may need to do some stretching and exercises. Again, it's a holistic approach. So I look at everything and I help you with everything.
Yes, you and I are in very much alignment with that, because one of the big epidemics right now is the opioid epidemic and the addiction to pain meds. And then when the doctors aren't prescribing the pain meds anymore, then we go into hard street drugs like heroin and things like that. And my profession, the American Physical Therapy Association, is really pushing choose PT first before somebody gets started on pain meds. And I would like to say, you had like a little disclaimer there too. I think that pain meds also have their place. If pain gets out of control following a surgery, it doesn't help the healing process. But pain meds were never meant to be taken for long term. They're short term to help kind of take the edge off following a traumatic event to the body, so that the body has a chance to heal itself and to rest. And that's where I think physical therapy, acupuncture, massage therapy, meditation movements like Tai Chi, yoga, these holistic approaches to self-care and also preventative care are really important, and that we work together. And I love that about just the holistic medicines in general, is because it's a conservative approach that fixes the root cause of the problem.
Right.
It's not just medicating. It's not just masking what is actually happening. It's getting to the root cause. Do you find that when you're helping people, but first of all, have you seen people who, have gone through some pain medicine addiction, or have been kind of on pain meds and reluctant to get off because they're not tolerating the pain when they start to wean off of them? Do you see that in your practice?
I mean, it's not extremely common, but I do have, from time to time, as a matter of fact, I have a fairly new patient right now who's dealing with multiple surgeries over the past 6 months. And yeah, he has to take several pain medications throughout the day just to function. So yeah, it happens, and people don't realize that they're getting addicted to this stuff because they're like, oh, well, I need this. You probably did initially, but again, going back to what you're saying, there are things like meditation that need to be taught, that people need to understand can change your brain chemistry and how your body functions, and help get you off of medications that you don't need to be on long term.
Right. The simple act of breathing. Some people just don't breathe correctly either.
Yeah.
So how do you help people then try acupuncture? You mentioned this a little bit. If they were anxious or nervous about needles, how do you help them try it? It sounded like you had a laser option for them. Could you describe that a little bit?
Yeah, so they're just little handheld lasers. Light is light. It doesn't matter how big the machine is or how small it is. Light is light. And studies have actually shown that by using laser, you can stimulate acupuncture points the same way you would with a needle. And they've actually done, I think it was either functional MRIs, or I'm not really sure what the device was, but they placed the laser on a point on the arm, and they could actually see it travel up the pathway up the arm and come out at another acupressure point. So it's quite obvious that it works. So a lot of times if patients are just super, super anxious and there's no way I'm going to get a needle in them the first time, then I will start with laser. And I do that for a lot of my younger patients too, because they're, super sensitive and scared and have no idea what to expect.
Mm-hmm. Right. And that actually leads me to, is acupuncture beneficial for kids? And how young can a child be to start acupuncture?
My youngest patient so far was 2 months old.
Oh, wow.
Yeah.
I wouldn't have guessed an infant.
Yeah. Chronic digestive issues, and mom and dad just couldn't get anything figured out. So I actually did a couple of treatments on her, and it was mostly Tuina, which is a specialized type of massage. And then I showed mom and dad how to do it, and I haven't seen her since because she's doing great. So
That's great.
Yeah.
So this massage technique, is that specifically address some of the acupressure points?
Yeah, so we focus on acupressure points the same way we would if we were using the needles or laser, and primarily stimulate those, but we also run along the known pathways, so what they call the energetic meridians in acupuncture.
Okay.
Yeah.
Okay. So a lot of people are listening today and they might be thinking, wow, that's a lot of scientific big words and things like that. And some people may also be familiar with like reflexology. Is reflexology similar to acupressure points, or is that separate?
It's a separate modality, but it uses pressure points on the feet. And I believe, if I remember correctly, reflexology is sort of part of the Ayurvedic line, which is Ayurvedic and acupuncture are quite similar to one another in the sense that they look at the body holistically. But one began in India and the other began in Asia. Specifically China. But yeah, they work very similarly as far as reflexology and acupuncture. It's just that when somebody's doing reflexology, they're only using the feet.
Okay. That's a big difference, because
Yeah.
acupuncture has, like you said, the 400 points.
Mm-hmm.
I don't believe reflexology has even close to that. If I
No, but from the models that I've seen, everything is represented on the foot in reflexology. So your big toe corresponds to something, your pinky toe corresponds to something else, etc. Yeah.
Right. And people, the reason I brought that up is because I wanted to point out a difference. There's some similarity, but more of a difference, because many people who are tuning in are looking for holistic, and they might know of reflexology, but not know about the meridians associated with acupressure points and things like that.
Yeah.
So what are some of the top 5 diagnoses that you might see to treat with acupuncture?
By far the most common is pain. And it's usually when people have tried everything else and nothing has worked for them. That is probably the number one thing that comes through my door. From there, it becomes things like stress and insomnia, digestive issues. And because I specialize, I see more of a couple of things. So I'm seeing a lot more eye conditions. I'm the only acupuncturist currently in Wisconsin to have specialized training to treat ophthalmology issues. So so that's a big one. And then I am also in the process of getting certification for stroke and neurologic rehab. So things of that nature, Parkinson's, MS, things like that. So yeah, I see a lot of that just because that's kind of what I'm promoting right now, and that's where I'm sort of focusing. I treat just about anything, but those are high up on the list.
Okay. Now, what kind of ophthalmology issues do you typically see? Is it
dry eye is a big one.
okay?
I see a lot of that. Night blindness is another big one. For whatever reason, we see a lot of that around here. Cataracts, macular degeneration, retinosa pigmentosa, glaucoma. I literally can help with all of those. So
wow.
Yeah, it's pretty amazing.
So do you get referrals then from ophthalmologists or optometrists?
A few. I also am part of a bigger group. The gentleman that I was trained by, Dr. Andy Rosenfarb, is located in New Jersey, and he actually has a website that is dedicated to what he does, as well as a list of all the practitioners that he has trained. He's sort of building his army because it's just too much for him to handle. There are too many people for him to deal with. He has people come in from all over the world, and he's been doing eye care for about 20 years.
Yeah, no, and I think a lot of my main audience is moms. And when I think of moms, though, moms are caregivers to children, but they're often also caregivers to adult parents and aging parents who would definitely be experiencing all of the eye conditions that you mentioned. So this is really great information, especially here locally in the Kenosha, Racine area. And for other people who are listening across the country, that they can now look out. Can you say the name of that person in New Jersey? Because they could go to the website.
Dr. Andy Rosenfarb.
Okay. Yeah, because they could go to that website if they're not here in Kenosha-Racine and find a list of providers that might be in their area.
And then going back to the training for the stroke and rehab and neurologic stuff, that too can be used for treating all sorts of stuff. And as a matter of fact, I use it a lot for treating neuropathy, which I have a lot of patients that are dealing with.
Neuropathy related to the stroke or to diabetes or
literally
any of the above?
And some of it's completely idiopathic. It just shows up out of nowhere. Well, the reality of it is it's been building up. They just haven't been paying attention.
Right. Yeah, I like to, when people come to me for back pain, and I usually say, well, you've probably been compensating, and they don't have a specific event. They like, I just woke up with back pain one day. I'll say, well, your body's going to compensate for a period of time, and then when it can't compensate, it's going to scream at you. You know, and that's kind of a lot of what we see is this, what once was like a mild ache pain here and there becomes this chronic thing over time. So one of the things that when you talk about, you see infants as young as 2 months, and then you talked about some of the aging. It seems like you have quite a spectrum of ages. And I believe when I was reviewing your website, you also work with patients with dementia?
Yeah, so believe it or not, this nanopuncture, which is the specialized training that helps with stroke, it focuses primarily on the brainstem and rejuvenating and regenerating the nerves that go to the brainstem. So if you think about it, every single spinal nerve that we have goes through that brainstem and the medulla. And if we're working on points on the back of the neck, you're going to be inadvertently stimulating or not stimulating, sort of downplaying, downregulating certain things. And that's exactly what this particular line of treatments does. So yeah, I believe it or not, I love dealing with the emotional stuff and the mind, because it's such a huge thing when they get that breakthrough.
Absolutely. And stress can be such a big trigger for so many people. I'm not just speaking of the dementia side, but sometimes with dementia, if they're stressed, if it's a new place, they're meeting new people, that triggers different emotions, it triggers different behaviors as well. But even just for people who are not experiencing dementia, just stress, it changes you a little bit.
Sure.
So
yeah. I mean, I absolutely have had patients that they're like, I won't go outside. I stop doing things because I'm so anxious all the time. And all it comes down to is they never learned how to handle their stress and lower their cortisol levels. And now they're at this place where they're, becoming these hermits, and they don't want to leave their house, and that's terrible. So yeah, it's amazing what can happen if you help people and get them to understand that they are in control of their bodies. Most of us don't realize that. We're so used to being programmed to believe that our doctors are the ones who make the decisions. It's your body, it's your choice, and it should always be your choice. So if you don't know how to handle something and you don't agree with what your doctor or any physician is telling you, get a second opinion. Go somewhere else. That's extremely important.
Yes, that's exactly right. And I liken it to you spend a lot of time researching to hire a plumber or a contractor or an electrician, yet people often just take it for granted. Oh, well, they said to go here, and they don't do the research. And I always like to say, look, you've hired me as your physical therapist to make you feel better.
Right. Yeah.
So you are hiring your healthcare professional, whether it's an acupuncturist, whether it's a physical therapist. I like to put that perspective into people's heads, because they should shop around and see if the healthcare provider they're searching for is in line with their value system, is in line with, maybe they don't want to take medication. And if they're choosing a healthcare provider who's just going to prescribe versus get to the underlying problem, then that may not be a good fit for them. So I think that's super important. Well, Kim, this has been really great to learn about acupuncture, kind of the history of acupuncture, how you got into acupuncture, and just the whole benefits and just the gamut of conditions that people kind of have access to, and they can come directly to an acupuncturist and seek assistance with. So I really appreciate you coming on the show today and sharing your story, sharing that you have other options for people if they're afraid of the needle, sharing how acupuncture can decrease pain and that it's not really a painful technique that a lot of people might believe it is. And I think that's really important for people just to have tools in their toolbox and resources of different type of treatments out there available to them. I appreciate you coming on again today, and I think that's all for today. Where can listeners reach out to you? Do you have a phone number? What is your website?
Yeah. So the phone number is 262-977-8793. The website is www.threemoonsacupuncture.com.
Awesome. Well, thank you so much, all of you tuning in today. Until next time, be bold, be beautiful, be you. Thank you.
Thank you.